Hey everyone, my name is Atanas, and we're doing this interview on behalf of Ophthalmology24. Our mission is to help young ophthalmologists all across the globe by sharing awesome resources. And we have a special guest here, Dr. Ivo Ferreira. It's a pleasure having you here. There's no need of introduction. He's one of the world's most famous educators when it comes to phaco, and he's the founder of Ophthalmology24, a very renowned institution. So, Dr. Ivo Ferreira, nice having you here.
The pleasure is completely mine. Thank you for what you're doing, Atanas. I think you're doing a great job, not only for Europe, but for the entire world in giving people who want to improve as surgeons so much information. Thank you.
Perfect. So let's dive right in. Dr. Ferreira, could you actually talk about the start of your journey in ophthalmology and your challenges that you faced during your ophthalmology residence and training?
Sure. I come from a small country in South America called Uruguay, in which I did a very long med school. It was like 8 years and a half. So imagine it was a long time, very difficult, a lot of resilience there. And then for me, it was very difficult also to enter ophthalmology. Ophthalmology, it's very competitive. And since we're a small country, it's not easy to get in. Thanks God, I prepared myself. I got into the program, but then the issue is the lack of surgical training. I thought of myself that I was unique in the world, the only person who has this disadvantage. And then with the years, I realized that this happens in many, many countries. So what happened for me was that I didn't have a chance in my country. So I started looking elsewhere, and I ended up in Mexico, in which I did a 2 year fellowship with no salary, in which I could have a lot of surgical exposure. And that's a little bit of my story. Because of personal issues, I needed to stay in Mexico, and I did have the time in order to pursue this passion of mine that was to be a mentor, to be a teacher. And I think I think that big uh, obstacle that I have in my life. If it wasn't for that, I would probably be in Uruguay doing surgery and seeing patients like everybody else.
Yes, it's amazing how far away we are, and despite this, I can totally connect with you, and I appreciate what you went through, because I actually myself went through the same thing, and many ophthalmologists in Europe and Asia and actually all across the globe are having difficulties with surgical training and are going through the same thing. Talking about the clinical fellowship that you did in Mexico, could you tell us a bit more about it? So, was it difficult to get in, and what was your surgical training? What were the difficulties there? How did you approach your learning?
Yeah, sure. Mexico has many different programs in which you can have surgical training mostly. Because medical training you can have everywhere, but
Mhm.
a very structured surgical program is not easy, even in many parts of the world. So what happened to me was the first thing was to answer your question. It was very difficult to enter.
Mhm.
I needed to come 2 or 3 times to present myself. I needed to do a surgical test in a simulator, and also a theoretical test to prove my knowledge. For foreigners, the good thing is you don't need to do all the paperwork in order to do surgery. I think that's a good thing. However, there is no salary. So imagine, and this is not easy for people to
Mhm.
be able to spend even 1 or 2 years without a salary. There is other programs like this in Mexico. I will say, like, from the top of my tongue, it's like, let's say, between 6 to 8 programs that you can have this. And again, it's a big investment, but if you are really motivated to become a surgeon, I think it's a great thing to do.
Okay, I see. Perfect. Let's switch the tempo and let's talk about Ophthalmology24 a little bit. We recently read in the Ophthalmologists magazine that you are actually recognized as one of the best, most impactful global institutions. Could you talk a bit about the idea of founding Ophthalmology24, launching it, and then going through the execution of the mission of teaching young ophthalmologists and surgeons, experienced surgeons actually, to enhance their training?
Sure. As I told you, after I finished my fellowship, I did 1,000 cases in 1 year. So imagine the volume. I did a big volume. Also, I was introduced to the surgical simulator with virtual reality called the IC. And after that, because of personal issues, I said, okay, so now I have a chance to teach. So, I started digging in. And the first thing we did is we found Ophthalmology24 as a digital platform. Mm-hmm. We wanted to have an open platform in which we could see talent, which we could see people who wanted to do different things and give them a space in order to communicate. We started being in meetings. We started being very well known for webinars. And then suddenly I said, okay, now it's time to have a physical campus, like a real campus. That started in 2020. And thanks God, we started, just training people from all over the world, and people will talk to each other, and people will know the program, and people will come from many, many different places. You are one of the amazing colleagues that we had the chance to have you here. You did a huge investment in order, to come, to train, to be open-minded, to train in a simulated environment, which is it's not an easy decision because many people say, I'm going to do surgery. The place to learn is the operating room. So I think you need to be very open-minded and see simulation as a big tool in order to invest to come to a course like this. So in this evolution, we started noticing that what we did was exponential. Because every people will train, every person, every colleague will train, will become a surgeon and will start doing surgery, right? While we were training other people. So actually we did the math. And in last year, if you pick all the students we have, we did this is an average, but we did a study that our students, our colleagues, actually, because we're part of a big family, they're doing around between 1,200 and 1,600 cataracts per year. So imagine the impact. Imagine the impact that we had. So at some point, we were contacted by the amazing magazine from the Ophthalmologist, and basically they said, "Guys, you really need to see how are you impacting in a very exponential way." Because when you train somebody, okay, that person is going to spend, 10, 20, 30, even more years doing surgery. So that's exponential.
Yeah.
So basically, Atanas, what we really want with this impact and what we want with Ophthalmology24 is not try to center everything we know in this physical space, rather than grab this knowledge, package it up, and put it in different parts of the world so many people can use it.
Fantastic. I totally agree. Like improving even a small amount gives you an exponential advantage because of the vast, the true scale of what you guys are doing. And being there on the site and being like a mentor that's supervising and giving tips and looking so many students, what would you say the best method of training is? Is it through dry lab? Is it through a wet lab or a simulation or a combination of both?
That's an excellent question, and I think it's a question we are answering every single day. And actually, it's changing. from day to day.
Mm-hmm.
What I really want with people is when people come with me, I would like them to put an objective and to aim for it and to make it happen, to
Mm-hmm.
respect the process, but to go for that objective. In order to do that, I am trying to be always very realistic. And by this, I mean, in my opinion, the best way to learn something is in a simulated environment. Virtual reality brings a lot to the table because it happens, you can change scenarios, you have objective feedback, you can practice the same task 50, 100, 200, 500 times. You can understand why you do what you do, etc. Then you have the wet lab scenario in which you are using the machines, you're hearing the phaco machine, you have the handpiece in your friend, you have the second instrument in your hand, you're pressing the foot pedals, you're gonna use in the simulator. So in my opinion, the best place to learn is a simulated environment with virtual reality and a wet lab. But we cannot forget the entire journey of a human being becoming a surgeon. So right now we are completely obsessed in what happens afterwards. So what we want now is what happens from training to the operating room. So what we're doing now is, okay, we know that the best place to learn is a simulated environment. You need to have a certain time with certain characteristics in which the elements are high fidelity simulation, a methodology in how an adult learns, and a mentor. I think the figure of the mentor is crucial. But then now we are going to, okay, so what happens afterwards? What happens when you finish this course? And then you have, in 1 week, you have the first surgery in the operating room.
Mm-hmm.
So I think there's a lot to train there. And let's be honest too, there is a journey in the operating room. I think you can, and every single person who is out there, if they make the decision to become a surgeon, we can help them in how to design this experience. You did an amazing article a couple of months ago about all these amazing opportunities that people have to go and do surgery in live patients.
Mm-hmm.
I think that's great. I think there is, you're going to need those numbers. You're going to need supervision in these first numbers. What I'm trying to say is, don't look at this as things that are detached from your journey. Let's try to design the entire journey for you. Let's try to understand the power of simulation and a simulated environment, I will say. And then let's prepare you for your first surgeries. And then also let's design your first, let's say 20, 30, 40 cases in the operating room. So, it's a very complex answer. And I think every single day is changing. And the good thing is people have now more the opportunity than ever.
Yep, totally agree. Completely agree with all your points. And I think for me, one of the best thing about a simulated environment is actually the ability to fail and to fail safely without harming the patient. So from your experience, how important do you think tackling a difficult task many times for a student and the ability to fail safely?
Well, I mean, there is a saying from Eric Rice, who actually he's an entrepreneur, which I really like and I would like to apply. He says, if you cannot fail, you cannot learn. Period. So we already know this. We already know that human beings are connected in a way that failure is the master of everything. So that's exactly what we want in a simulated environment, to make failure, okay, part of your training with not harm for another human being. So people open up, people understand this, and they learn in a completely new way. I think this will be my most important message, to all the young or old people around who want to become surgeon. I think now you have a chance now, but you need to think different, and you need to put an objective, understand the journey, understand the process, and it's very important at some point you do your training in a simulated environment.
Completely agree.
But for everything, right? Let me not be for. Let's not only talk about cataracts. Let's talk about retina, or let's talk about a new device. You're doing amazing things with glaucoma, right? Let's say I'm a cataract surgeon. I want to learn to do mix. Okay, I want to learn to do mix. What if we do it in a simulated environment? Because it's completely different to do a wet lab in a meeting. Oh, yeah, the mix, this is the lens. Let's put it out there. No. That's great. That can give you some skill. But I'm talking about a real simulated environment in which you, for example, in mix, you are designing all the instruments you're going to have, the microscope you're going to use in the operating room, the dialogues you're going to have with the people assisting you. I'm going to ask for this instrument, for that instrument. If this goes right, if this goes wrong, let's simulate if everything goes wrong, what they can do next. I think the power of simulation is huge, not only for people in the beginning of their training, but to become competent, excellent, and even masters.
Yeah. I think it definitely has a great advantage there. And regarding to this, when I was in Ophthalmology University, what struck me most is that you approach learning surgery not just as like a simple task. You need to finish the simulator course, but you take surgery as this unique approach, the same way that elite athletes actually approach their sport. I know sport plays a big role in your life, and how would you say that? What do you find common between a surgeon and an elite athlete? This is actually a very nice question related to the Olympics now.
Oh no! I'm so glad you mentioned even the Olympics, because I do believe that from Olympians we're very close to those kind of athletes, and I'm gonna tell you why. But you said something very interesting. You said that we should treat ourselves as elite athletes. That's definitely a fact. Think about it. Think about it. We do something in which we need to succeed in every single time, in which failure is not an option. It's not an option. You don't have the option to fail. And you need to excel every single time. And I believe when you make the decision to become a surgeon, you're thinking about the technical skills. You're thinking about the motor skills. Probably some people are talking about the decision making and the problem solving, but very few are really talking about what it means to be a surgeon, what it means to have a complication, and then 5 minutes later being talking to the patient or to some relative of the patient saying things didn't go well, or that Friday night that everybody's partying and drinking a beer, but you had 18 cases and two you had 18. 16 were great, but two didn't go as well as you wanted, and now suddenly your brain it's like. So we don't talk about those things, and that's exactly what we want here. We want that approach. So we want to talk about the mindset component of becoming a surgeon. And it's funny because since I like to talk about athletes, many people were talking about this amazing speech that Roger Federer did in Dartmouth a couple of months ago.
Oh, amazing. Yeah.
Amazing. But Roger was saying, I was number one in the world, winning 52% of my points. And I was saying, okay, good. Yeah, you can fail. You can lose some games. You can lose some sets. You can lose some. But we don't have
we
that.
We don't have that. Wow.
So what happens with the mindset with somebody like an Olympian that trains 4 years for one shot? You know what I mean? And I think that's a completely different mindset. And this is something you really need to train. And I think if we think as elite performers This is the way of thinking that we need to have. We need to be in one way as a performers, elite athletes, and create this moment to deliver the best we can. But in another way, we need to remember that we are human beings, and this is a role that we have, and we also need to try to disconnect from this. This is very complex. I don't want to get very deep, but I want people to have at least an idea of the way we approach surgery, right?
Yeah, it's a very nice overview. Okay, let's switch to your tips towards young ophthalmologists. As someone who has navigated like such a difficult path in your career and then end up being one of the best educators in the world, what advice would you give to young ophthalmologists who are just starting their journey and want to become great surgeons? What should they focus on?
Perfect. I think, again, I'm going to repeat a little bit myself, but the first thing, everything starts with a choice. Everything starts to really do an introspective journey of making the decision to become a surgeon. This is not about seeing phaco and saying, oh, this is so good, looks so great, and I don't want to do that. No, this is much bigger than that. But after you make that decision, because I think you should, because it's an amazing career, it's an amazing thing to be a surgeon and a cataract surgeon and improve people's lives with your job. I think it's something incredible. But after you do that, I really, it's as simple as this, to put an objective, to actually close your eyes and visualize yourself in that day that you're ready to do a case by yourself, to do 50 cases in one morning, to do a surgery of a relative, or, so many other things. And when you actually see that, then start looking for the process to make it. My advice to young people is they have amazing ways to do it now. It's much more easier than in the past. In the past, it was difficult. We didn't have high fidelity simulation as developed as now. We didn't have so many mentors, and we didn't have also the technology to do this kind of thing. Imagine, I was talking about following people in the first cases. We put, and I don't have any commercial interest, but with many of our students, what we put is a device. This case is called microrec in the microscope. And suddenly I am giving you real-time feedback watching your surgery, no matter where you are in the world. Okay, this is huge. So this is exactly what you guys, young people, need to do. You need to leverage technology for your favor. So what I strongly recommend is make the decision, put the objective clear in your mind, and let's design that process. If you cannot design that process, we can help you. And this doesn't mean that you need to train with us. I mean, let's say you are from Poland. Okay, you're from Poland and there's no way you can do surgery. Okay, let's find you. The first thing is, let's find you a very important course, a simulated course with a good mentor. Remember, the other concept is try to find a mentor. It's the most difficult thing to do. But in the moment you find a mentor, everything becomes easy. Mentorship is not easy and also can be leveraged through technology. Probably the mentor doesn't have time for you, but with technology, you can even pick a mentor and pick his brain. Let's put an example. Pick the brain of Ike Ahmed. You want to pick the brain of Ike Ahmed? Go to YouTube. As simple as that. Go to YouTube and watch everything he does.
It's already there. It's already published. You just need to take your time and watch it. Yeah.
Exactly. We didn't have that 10 years ago.
No.
You couldn't pick the brain of a genius like that 10 years ago. So that's exactly what I'm trying to say, people. And my obsession, my personal obsession, is exactly that: is to help people design that kind of journey. Right? Is that person from Poland, to connect them to a very simulated course, and then to help him from simulation to the operating room, and when they're in the operating room, to try to give them the most important thing that a mentor can give you is guidance, but feedback.
Mhm.
Feedback. You need feedback in order to improve. So I think we are living in exciting times, Atanas. I think what you're doing is great, and please keep doing it, because there's many people, we need many people like you to connect young people who had dreams, and who are very determined, right, and has this passion about becoming a surgeon. Sometimes it doesn't look easy.
Fantastic. I'm all for leveraging technology in order to enhance your skills, and we're happy enough to live in times where we have so much information available. Actually, you need to prioritize where you learn from. Speaking of this, you obviously have a lot of resources at Ophthalmology University, a lot of courses online. So would there be any specific that you recommend for young ophthalmologists that would greatly impact their career? Feel free to recommend any other books, courses.
Sure. There's many, and I think many people know them. There is, for example, something, think about it, such a great work done by two or three surgeons in India who are putting so much content, which is amazing.
Mm-hmm.
From the US, Canada coach, everybody knows him, because the amount of content that we have there, so much you can learn. There is many other resources. Actually, there's people who actually love surgery, and they love cameras, they love image, and they do videos. Like, for example, Dr. Telegin from Russia. You see this guy with such great quality and doing very interesting things.
And passion. He's very passionate. Yeah.
To communicate with no business model behind it, which I love. So I will recommend that kind of content. But what I believe is that content only keeps you mostly like cognitive knowledge, meaning about to see patterns, to recognize patterns, and to make decision making and problem solving. What we have been doing, and we have been doing it in English to reach everybody, we have been doing it in phaco mentors with a different perspective, because what we want there is we want to give you the entire perspective, right? We want to give you, for example, one of the things we like is we would like to put 3 cameras in the surgery, so you can see what happens in the hands, what happens in the incision, what happens outside the eye, for example. The other thing is we do also on phaco mentors is to leverage virtual reality. So we put the virtual reality video, okay, in order for you not only to understand decision making, but also solve complications and talk about the mindset when complications happen. So yeah, I'm a little bit biased here, but I would strongly recommend phaco mentors as a platform to have a different perspective of surgery.
Perfect. I would totally recommend it too. There are so many webinars and resources. We'll post the social media so that you guys can follow them, and they'll keep you in the loop. I know that you're very interested in philosophy and self-improvement, and maybe this is the time to ask you, could you recommend any books that are outside of medicine, outside of ophthalmology, that could help surgeons develop this winner mindset, this basically mentality of improving constantly and getting better?
Oof, you already know me in this one, and I have so many ideas, so I'm going to try to make it short. I'm going to do something because of you, because I think what you do is great. I have many books that I love, and there's a couple of books that I'm like, you know what, I'm not going to even recommend this kind of book because they're so good that I'm going to keep it.
Okay.
I'm going to do the opposite only for you. And And if somebody is behind this dream of become a surgeon, I think they need to start with the book called Mastery from Robert Greene. Mastery is a book that is going to exactly say that. It's going to basically tell you with different disciplines in this life how you can go from a dream and an objective to a real mastery in any discipline. So I think that applies for surgery. I strongly recommend Mastery because of what surgery means. I strongly will recommend also a book called Principles from Ray Dalio, which is completely amazing. And also to be grateful and to be simplistic in a good way, I'm going to recommend another book from Mexico, in which I'm very grateful for this country to allow me to become a surgeon and to have our campus. It's called The Four Agreements. Okay, that basically is very simple. It talks about 4 agreements in which I think that are extremely powerful for surgery. With those 3 books, I think I did an interesting job there.
Thank you. That's a very nice insight. Appreciate it. Let's talk about your vision of the future. So obviously, simulation surgery, especially the VR simulators, have advanced like beyond any expectations. They are really this is another exponential technology that we should definitely leverage. I remember myself like the journey. So I practiced on the simulator first time like 5 years ago, and the software and the hardware is just improved like tremendously. So you being more in the game, where do you see this going? How has this improvement been over the years, and where do you see the technology going?
Well, and this is secondary to a discussion with another great friend called Christos Ifatidis from the US. He came to visit me. We were in an open discussion, and he did something to me. He basically ruined me in a good way.
Okay.
Because he basically said, Ivo, you're making a mistake. You're thinking about today and what's going to happen in the future. Let's do something different. And that's exactly what I want to do with you, Atanas. Let's think about the future and then come back to where we are. Let's think about a moment, call it 10 years, 15 years, 30 years, I don't care, in which you can 100% be trained virtually. Think about it. Can it be possible? Of course it can. You're going to have the machines and the instruments, but you're going to have a VR and an Apple Vision Pro, very advanced, in which you're going to enter the operating room, and that's going to be the patient, and then you're going to perform surgery 100% virtually with high fidelity. So I hope I can live until that day. I think we're far away from it, but I think we're gonna reach a moment like that. So what I think is exactly what you say, that we're gonna take huge leaps progressively into have machines that is gonna give you high fidelity in order to train. So that's what I see in the future. I see fidelity going up, especially with virtual reality, because it's much easier to improve. Of course, I think we're going to improve the quality of artificial eyes. So I believe that the simulator environment is going to be every single day even more important than the day before.
Fantastic. I completely agree on your point, and we are seeing this before our eyes with the new software developments and that are coming constantly. Okay, I want to finish this awesome interview with a very interesting question. So I heard that something interesting is coming up in Europe that is going to revolutionize the surgical training. Could you give us a small insight on that one?
Well, I have been so lucky because with what I do, I get to, for me, it was very difficult to become a surgeon. And I think I see every single week, I see people with that dream, and I think I can give them a lot of value. So then I had the chance to travel to other places. Then we realized that this is something that happens almost everywhere. That actually there is few countries who actually train people, with big volumes. So one of the things that happened is we saw that in Europe. We saw people who are so smart. We saw people who are so motivated, are so ambitious in a good way. In a good way. They want to become surgeons. They want to become good. They are smart. They dedicated their lives to become doctors and ophthalmologists. So why not to become cataract surgeons? And then, as you probably know, and everybody knows, cataract surgery is only rising. We every single year we need to do more surgery, and there is many research that are showing that the number of surgeons is decreasing more than that it's increasing with people, new people coming. So when we saw that, we wanted to do something in Europe. I think there is many things great coming in Europe. The first thing is what the ESCRS leadership is doing. I think the ESCRS leadership now it's very strong in saying we're going to do something about it. You have been part of that in Germany with a moving simulator and training people all over Europe. And what we want is to add some value to that and to put an excellence center there with great mentors. Because remember, it's not easy to do this kind of thing. Think about a mentor. Think about a surgeon who is actually making the conscious choice instead of doing surgery and seeing patients to be with you and train yourself. This is not easy. No. So that's exactly what we want to bring to Europe. We want to bring an excellent center in which you can learn as much as you can in a simulator environment, and we prepare you for what comes next. So hopefully, very soon we're gonna have a center like that in Europe.
We're definitely excited to hear more about it, and we're gonna follow you on social media, waiting you for give us more info. Well, it's been a great pleasure, Ivo. I love talking to you. That inspires me, and we could really see your passion that you're doing this from your heart. You're enjoying it, and this gives it another angle it's just makes you feel good, and you make the world a better place. So thank you for what you're doing, and thank you for this interview.
Thank you, Atanas. You inspire me. You inspire me by communicating this, and I think all the colleagues have the chance to be so much impactful for other people that this is something we really need to enjoy, and we really need to behave as a community and help each other and raise the game, all of us.
Yes, awesome.